All right, so today we're diving into something that I think is really fascinating.
Yeah,
It's at this really interesting intersection of healthcare and technology.
absolutely.
Um, and healthcare tech is something that I think a lot of people find fascinating, but it can be really complex and hard to wrap your head around.
For sure, for sure.
Um, so today we're zeroing in on a company called Mosaic,
Okay.
and they're making waves in the NHS right now with their electronic document management system,
Right.
an EDMS,
EDMS, yeah.
which is a pretty big deal for a system that's historically been very fond of
Yeah.
its paper trails.
Indeed. The NHS's journey towards digital transformation has been
Right.
quite the saga.
Yeah.
Lots of twists and turns.
Yeah, and we've got two fresh press releases about Mosaic that kind of caught our eye.
Yeah.
One announcing a whole bunch of new hires,
Wow.
and another featuring some surprisingly candid reflections from their CEO after about 9 months on the job.
Interesting. An interesting mix, offering a glimpse into both the internal growth of the company and then also the leader's perspective on kind of the bigger picture of what's happening in the industry.
So for those who might not be as familiar with this world, let's break down why an EDMS matters,
Okay.
especially for a system as complex as the NHS.
Mm-hmm.
I mean, we're talking about a massive network of hospitals and clinics all dealing with tons and tons of patient information.
Yeah, think about it like this. I've got a doctor in London who's treating a patient who, let's say, was recently transferred from a hospital in Manchester.
Right.
That doctor in London needs immediate access to that patient's complete medical history.
Oh.
Now, with a traditional paper-based system that could involve days, even weeks of trying to track down records,
Wow.
it's incredibly inefficient and, frankly, a bit scary to think about the potential for errors or delays in treatment because of that.
And the cost associated with that, too.
Absolutely.
I mean, if you think about lost or misplaced records,
yeah.
the risks associated with that.
Huge.
And not just the efficiency, but patient safety as well.
Absolutely. And in fact, Mosaic's CEO, John Pickering, actually points out that some hospitals are spending more than £1 million each year
Wow.
just to manage their paper-based records.
Really?
Just imagine if even a fraction of that budget could be redirected towards
Yeah.
patient care or investing in new medical equipment.
Right.
I mean, that's a powerful argument for change right there.
£1 million a year. That's astonishing.
It's a lot of money.
It really highlights the need for change.
Yeah.
So where does Mosaic fit into all of this?
So they're not new to the scene at all. They were previously known as IMMJ Systems and have a really strong track record with their flagship EDMS product, MetaViewer.
Okay.
They've been doing this for a while and racking up successful digitization projects with various NHS trusts.
It seems like they're stepping things up a notch, though.
Yeah.
One of the press releases mentioned a £1.8 million investment.
Yeah, that's right.
So clearly, someone sees their potential.
Absolutely. And that investment is clearly fueling their growth, which leads us to the news about their latest hiring spree.
Yeah.
6 new team members.
6.
That's a lot.
That is a lot. That's quite the team expansion. And what I find really interesting is that it's not just like they're beefing up their tech team,
Yeah.
although they've done that too.
Right.
They're bringing in expertise across the board, from service delivery to geographically focused sales roles.
For sure.
It seems like they're thinking long-term about supporting NHS partners and expanding their reach strategically.
You hit the nail on the head. They are thinking long-term. They're not content with just being a regional player. They have national ambitions, and they understand that to be successful in the NHS, it requires a multifaceted approach.
Yeah, and speaking of that, let's talk about their new service delivery and support manager, Katrina McGill.
Okay.
Her appointment really highlights, I think, something that's really important, and that's customer focus
Yeah.
in this world of healthcare tech.
It's essential.
Even after a project is completed, it's not just about installing the software and then walking away. It's about providing that ongoing support and ensuring that it's actually making a difference for the clinicians and for the patients.
Building those lasting relationships and understanding that technology is just one piece of a very complex puzzle.
Exactly. And speaking of understanding the bigger picture, let's shift gears a little bit and talk about those CEO insights.
Okay.
I have to admit, I was really impressed by how candid John Pickering was
Yeah.
in his reflections.
I agree. It wasn't your typical PR fluff piece.
Yeah.
It was very refreshingly honest.
He seems genuinely proud of the progress that Mosaic has made, securing that funding, expanding the team, working on their product roadmap.
Right.
And this is where it gets interesting. He doesn't shy away from the challenges.
Okay.
He openly expresses concern about the UK's economic climate and the slow pace of funding for these large-scale NHS technology projects.
Yeah, it's refreshing to hear that level of honesty from a CEO, especially in a field as complex and often bureaucratic as healthcare.
Yeah.
He's acknowledging that these digital transformations don't happen overnight.
Right.
They require significant investment and long-term commitment from everybody involved.
And let's be real, when we're talking about a system as massive and complex as the NHS, you really have to demonstrate that return on investment.
Oh, absolutely.
Nobody's just going to throw money at a problem without seeing those results.
Exactly. And this is where Pickering's focus on the financial benefits of a robust EDMS, I think, becomes really key.
Okay.
He's not just advocating for this technology based on, some idealistic vision of a paperless future.
Right.
He's highlighting the actual ROI, the return on investment for these NHS trusts.
Right.
Many of which, as we know, are already grappling with some pretty serious financial constraints.
Yeah, it makes a lot of sense.
Yeah.
So it's not just about embracing technology for technology's sake.
Right.
But it's about making sure that the solutions that are being implemented actually address these real-world challenges and ultimately lead to better patient care.
100%. And that leads us to, I think, another really critical aspect of this whole digital transformation journey.
Okay.
This idea of moving towards what are called integrated care systems.
Right.
Or ICSs for short.
ICSs.
Right.
Right. This whole concept of connecting data across different regions and care settings. I have to admit, even with all the advancements we've made in technology, that still sounds like a logistical mountain to climb.
It's a massive undertaking. There's no doubt about it. And Pickering doesn't try to sugarcoat the complexities involved at all.
Right.
He acknowledges that achieving true interoperability between all of these different systems and regions, it's not going to be easy.
Right.
We're talking about integrating a patchwork of legacy systems.
Yes.
We're talking about ensuring data privacy and security. And then you've got the whole issue of navigating all the intricacies of data governance across this massive network.
It's like trying to weave together this tapestry from thousands of different threads.
1,000%. 1,000%.
So where does Mosaic see themselves fitting into this?
Right.
This whole puzzle of ICSs and this interconnected data.
This is where I think their vision gets really, really interesting.
Okay,
They're
go on.
positioning themselves as kind of this central data hub,
Yep.
this secure and reliable repository for all of this patient information that can then be accessed by authorized personnel
Right.
across that entire care continuum.
Okay.
Imagine a specialist in London being able to instantly access the medical history of a patient who was just treated at a hospital in Manchester.
Yeah.
That level of data sharing is truly revolutionary.
Essentially, they want to be the glue that holds this whole ecosystem together.
In a way, yeah, but I think what sets them apart, and this is something that Pickering emphasizes,
Right.
is their commitment to what they call open interoperability.
Oh.
They're not trying to create some kind of closed system that locks NHS trusts into only using Mosaic products.
Right.
They understand that the future of healthcare data really hinges on collaboration.
Yeah.
And the seamless exchange of information between all these different systems and stakeholders.
Which, let's be honest, is incredibly refreshing to hear.
Yes.
Especially in the often very competitive world of healthcare technology.
For sure.
So if we kind of zoom out a bit here.
Yeah.
What does all of this mean for our listeners out there who are fascinated by this intersection of healthcare and technology?
Yeah.
What would you say is the key takeaway here?
I think the key takeaway is that the future of healthcare is digital.
Yeah.
This isn't just some passing trend.
Right.
It is a fundamental shift
Yeah.
in how healthcare systems operate and ultimately how they deliver care.
Right.
And while I think that can feel a bit overwhelming at times,
Sure.
it's also an incredibly exciting time to be following this space.
Absolutely. Companies like Mosaic are really pushing those boundaries, and they're giving us this glimpse into what's possible. When you combine this innovative technology with a really deep understanding of the healthcare landscape.
100%. But it's important that we don't get too caught up in the hype.
Right.
We need to be thinking critically about the bigger picture.
Okay.
How does this technology actually impact patients
Right.
on a day-to-day basis?
Yeah, what are those effects on healthcare professionals who are working on the front lines?
Exactly. And what are the ethical considerations that we need to be thinking about as we navigate this new terrain?
It's easy to get caught up in all that excitement
Yeah.
and forget to kind of hit the pause button and ask those big questions
Right.
about the impact, for patients, for the healthcare system as a whole.
For sure. And speaking of impact, that brings us back to something that John Pickering mentioned, kind of towards the end of his reflections.
Yeah.
The fact that over 100 acute hospitals in the UK
Wow.
still rely heavily on paper records.
Really?
Which just kind of blew my mind a little bit.
Over 100.
Over 100.
That's really a stark reminder of how much work is still left to do.
Absolutely.
And think about it from a patient's perspective.
Yeah.
Imagine waiting anxiously for, some crucial test results.
Yeah.
Only to find out that maybe there was a system glitch.
Oh.
Or your records are somewhere.
Right.
In mountains and mountains of paper files.
Buried in the basement somewhere.
Right. And that's the reality for a lot of people.
It is the reality, and it's a real illustration, I think, of the human cost.
Yeah.
Of slow digital adoption. It's not just an abstract concept.
Yeah.
It has real-world consequences for patients and their families.
It makes you really appreciate that urgency of this digital transformation.
Absolutely.
And not just from a, logistical or financial standpoint,
right,
but from a human one.
From a human perspective, yeah.
It's about making sure that those healthcare professionals have the best tools possible to provide the best possible care.
And that's what it's all about at the end of the day, right?
Exactly. As we wrap up this deep dive, we've really only just scratched the surface here.
We've only just begun to peek behind the curtain.
But we've explored this potential of EDMS to really revolutionize healthcare data management.
It's a game changer.
But it's only one piece.
One piece of a much larger puzzle.
Right. This shift towards integrated care systems adds a whole other layer of, complexity, but opportunity.
Complexity and opportunity for sure.
Yeah, it's like we're witnessing the birth of a new era in healthcare.
It's exciting.
Where data is no longer confined to these paper files or these isolated systems.
Yeah, silos of information.
Right. But it flows seamlessly across the entire continuum of care.
That's the dream.
So for our listeners out there, this means staying curious.
Absolutely.
Staying informed. And most importantly, asking those questions.
Asking the tough questions.
About how these technological advancements are impacting
real
people.
Real people in the real world.
Because at the end of the day, healthcare is about people caring for people.
100%.
And technology should just empower that and enhance that human connection.
It's a tool.
Yeah.
That's all it is.
Not overshadow it.
Well said. This has been a fascinating conversation.
It really has been.
I've learned a lot.
Until next time, everyone.
To the next deep dive.
Keep exploring, and we'll catch you on the next deep dive.